Most people don't think about medical supplies until they need them. But the moment you reach for something, and it's not there, everything changes. Because running out of basic medical supplies doesn't just create inconvenience. It creates hesitation. And in a medical situation, hesitation has consequences. At first, it's usually something small. You look for a bandage, and realize you're out. You need pain relief, but the bottle is empty. You expect something simple to be available, and it isn't. Individually, these moments don't seem serious. So you improvise. You use something else. You delay treatment. You tell yourself it's not urgent. And sometimes, that works. But not always. Because small gaps in preparation tend to show up at the worst possible time. A minor cut that should have been cleaned and covered properly is left exposed. A manageable pain becomes harder to tolerate. A simple issue becomes more complicated than it needed to be. And that's where frustration starts to build. Because the problem isn't just the situation. It's the realization that something basic was missing. So people react. They decide they need to be more prepared. They start thinking about what they should have had. Bandages, disinfectants, basic medications. And the instinct is to fix the problem by getting more. More supplies. More backups. More of everything. But that's where a deeper issue starts to show up. Because running out of supplies isn't always the real problem. The real problem is how people depend on them. Most people are used to a system where supplies are always available. Pharmacies are nearby. Stores are stocked. Replacements are easy. So they never think about absence. Until it happens. And when it does, the response is often reactive, not structured. People try to replace what's missing. But they don't change how they think about using what they have. So even when they restock, the same vulnerability remains. Because the real issue isn't just availability. It's awareness. Knowing what matters most in a situation. Knowing what cannot be replaced easily. Knowing what needs to be used early, and what can wait. And that's the turning point. Because once supplies are limited, priorities become clear. You start asking different questions. Is this necessary right now? Is there an alternative? What happens if this gets worse? And that shift changes how decisions are made. Take something as simple as treating a wound. With full supplies, the process is routine. Clean it, disinfect it, cover it. But without them, you're forced to think differently. What's the risk of infection? How can you keep it clean? What signs should you watch for? And suddenly, what was automatic becomes intentional. The same applies to medications. Without easy access, people become more aware of how and when they use them. They don't take something just because it's available. They consider necessity, timing, impact. And that awareness changes behavior. Because the real issue isn't running out. It's not knowing how to operate when you do. The real issue isn't the missing supply. It's the missing framework behind its use. And once that becomes clear, preparation stops being about having everything, and becomes about understanding what actually matters. Because in real situations, you rarely have perfect conditions. You work with what you have. And the difference between a manageable situation and a worsening one often comes down to how you think in that moment, not what you own. If you want a more structured breakdown of how to think through situations like this and what kind of preparation actually makes a difference, there's a practical guide linked in the description that goes deeper into this. You can also subscribe if you want more videos that break down real-world scenarios like this in a clear and realistic way. Because when something runs out, what you understand is what remains.